Hey guys, how you doing? It's Shaquila coming to you guys with the insurance video, insurance covering bariatric surgery. I tell y'all, I did this video maybe 6 times today, but because me having children, I had to go over it and over and over it. So this is my final one. I'm gonna try to give it all I got. It's Sunday. Thank God for another day. You hear me? We are so blessed, guys. So, anyway, back to weight loss and the insurance part of it. Mainly speaking about Medicaid because that's what I have. But don't get discouraged, guys. I mean, all insurance have their own requirements, but mainly I am coming to you guys about the Medicaid part of it. Also, I encourage you guys, whatever insurance you have, do your research. Call the number on the back of the card. I know for me, since I have Medicaid, I called that 1-800 number on the back of my card, and the lady, she was so nice. She directed me to the right person, and they pretty much gave me the rundown of what I needed for surgery, the requirements, and what they would cover. So don't be discouraged. All insurance is different. Just because I have Medicaid doesn't mean I'm not paying out of pocket for anything, because I am. And I'll get into that a little later if I have time. Try not to make this video so long. But, well, I'll get into it right now. Medicaid has co-pays. A lot of things that it doesn't cover. Medication, we have co-pays. Doctor's visits, we have co-pays. A lot of things. Even the nutritional classes, those are $100 a piece. So just because you have Medicaid doesn't mean you're not going to come out of your pocket. So that's a heads up. A lot of people, bariatric surgery is kind of like the elephant in the room. And what I mean by that is a lot of people think, like a lot of you guys said in your video, that, it's an easy way out, that this is just going to be it. No, this is a lifestyle change. I've seen people go through it, not necessarily the whole process, but I know someone myself who's going through it, and it's hard. Some days it's rough, so it's definitely not easy. I don't want to speak too much on it because I haven't went through it myself, but let me get into the insurance part of it. Okay. So I told you guys in my last video, I have a bunch of papers here. Sorry. I told you guys in my last video that next week, this week coming up, because today's Sunday, that I have a psychological exam. For me, and this is just my advice, this whole video is just my advice. And I also want to point out that I went online and I Googled if Medicaid covers bariatric surgery. It took me to the official Medicaid page. It's kind of better than talking to a person. It gives you the rundown. It gives you what revisions they'll cover. Like I have right here, what kind of procedures Medicaid cover. They cover the RNY, the gastric bypass, the adjustable band, which is a lap band, pancreatic diversion with or without duodenal switch, revision of bariatric surgery. So say you have the sleeve, and you have like really bad acid reflux or the lap band and you're having some problems, you want to go ahead and get it revised to the gastric bypass. They'll cover that. I mean, it's a lot of things, guys. You just have to look into it. So anyway, I Googled that and it took me to the official page, and you'll get a lot of information. It's out there. That's what all these papers are. So I kind of want to go over some things about the psychological. The psychological is a really big part, guys. I mean, It really is. I'm sure the people, a lot of women up here who've already had the surgery, I'm sure they touched on this, or felt that this was a really big part of you getting approved and going to that next step. They want to see that you are mentally ready for this lifestyle change. You guys, it's a major surgery, major. And my doctor even pointed out that the surgery was reversible. I didn't know that. I wouldn't even thought of that. But he was like, we're not taking anything out. Unlike the sleeve, they're taking out, 80% of your stomach. The gastric bypass, they're not taking anything out. So do some research on that too. I mean, my mouth hit the floor when he said that. I probably said that before, but I mean, I just couldn't believe it. He was like, if you have all your organs, why not? All right, so here we go. The psychological, I believe, is a very big part of it. And I just kind of want to read to you what I researched off of the official Medicaid page. The psychological evaluation. The bariatric team shall include a licensed psychologist, psychiatrist, and or licensed social worker on the requesting surgeon's multidisciplinary pre-surgical preparatory regimen and meet all the following requirements. So for you guys who are new to this journey like I am, listen up, guys. This is very important. I don't think without this, any insurance that we'll be able to get the surgery. So that's why I wanted to share this with you guys. There might be a part 2 coming. Let me know in the comments below if there's anything else you guys need or want to know that you don't already know as far as the insurance for Medicaid. So anyway, the clinical healthcare record documentation of a psychological initial evaluation assessing for any psychopathology. Correct me, y'all, in the comments if I said that right. Which may interfere with the recipient's suitability for surgery. Ability to comply with lifelong dietary changes and medical follow-up. The initial evaluation shall include the components of such an assessment to include all of these that I'm about to read. This is what we're going to have to do. Mental health history, mental health diagnosis, current mental health treatments, eating behaviors, past and present, substance abuse evaluation, stress management, cognitive abilities, social functioning, self-esteem, personality factors, readiness, and ability to adhere to required lifestyle modifications. I told you guys, that's a biggie. I mean, you cannot go to the psychological exam and say, oh, I want to be in a bikini. That's what this done. No, guys, it doesn't work that way. Don't do that. Don't do it. Trust me. You won't get approved. Okay? Be serious about it, guys. This is serious. This is your body. So just make sure you're ready. Follow up. Recommended for any issues identified, and identifies the social support in place. I think that YouTube is a social support. You know, we're all getting to know each other. We're all a YouTube family, as everybody says. I hope I can say that, y'all. And this is definitely important. This is a big factor. Like I said, it is a lifestyle change, and they want to make sure that if you do have any issues, that they kind of sort through them. They might not just write you off right away, but depending on what it is. So like I said, go check this out. Google it for Medicaid, the requirements. It'll take you to the official page. Click on the bariatric surgery for North Carolina, and it'll come up as North Carolina Division of Medical Assistance Surgery for Clinical Severe or Morbid Obese. Yes, we're morbidly obese. I'm over 100 pounds, a little over 100 pounds or so overweight. So very, very, very important. They also have like the cosmetic follow-ups for you guys who've had the surgery. And basically they're saying up here, weight loss surgery, weight loss following surgically for clinical severe or morbid obesity can result in skin and fat folds in locations such as medial upper arms, lower abdominal area, and medial thighs. Surgical removal of the skin and fat for solely cosmetic purposes is not covered. You guys, they even got up here pregnancy. Bariatric surgery is not covered during pregnancy. You know, and this is saying for Medicare and Medicaid, I think they give you the requirements. But, you know, having the skin removed after that to get your insurance to cover it is major. That is something you also might want to think about before you get this surgery. It's a big deal. You would have to really complain, I hear, of how it's maybe bothering you emotionally, all those kind of things. Is very hard. So, and to be honest, I would rather have loose skin than be almost 300 pounds overweight. Also, it depends on your age, the elasticity of your skin, a lot of different things. So don't feel like, some people have it really bad, some don't. But it's just something to know, something that I would want to know. So that covers some things. It's a lot. I would encourage you guys to basically go and look it up. Now for, I told you it's a lot of pages. Let me know if you guys want a part 2. Don't forget that. For my surgeon that I'm going to, they made me a checklist as they do everybody. And my surgeon is James Harris in Wilmington, North Carolina. I live about 2 hours or so away from there. I'm not gonna tell east, north, west, whatever. I'm not gonna tell that, but I live close to Wilmington, not that far away. And that's where I am getting my surgery and doing everything. Like I said, the office is great. Coastal surgery specialists. They're awesome. They're awesome. Haven't had any problems, guys. I just love that office. So they've put together a checklist, as I'm sure all of wherever you guys are getting it done, it has to be done at a center of excellence as well. So I'm sure wherever you guys are getting it done, they'll put together a checklist for you too. But in Heather and Nurse, in one of my earlier videos, she kind of covered and touched on these things a lot. I'll kind of read them verbatim. I'll go ahead and reread these things. So, and I kind of want you to have this stuff too before you get to them. And then there's a next step in, you know, scheduling your second visit. So for my surgeon in Wilmington, 5 years of medical records documenting your weight and blood pressures. Now they change it to 3. Current thyroid stimulating hormone tests. It's a lab test. It shouldn't be, this test should be no more than 1 year old. Current HbA1c lab tests. Only if you have diabetes type 1 or 2. So that's something I have to still do. This test should be no more than 6 months old. Current H. pylori blood tests for gastric bypass only and TRICARE only. That's another type of insurance. TRICARE, Blue Cross Blue Shield, United Way, or is it United Way? I don't know. But anyway, that test should be no more than 6 months old. A letter from your primary care physician to include prior attempts to lose weight, diets, diet pills, exercise, whatever. Include it all. The more, the better. So by the time that, you know, it goes to be submitted to Medicaid, I mean, you should get a fast approval. Who knows? I don't know. They say it takes about 2 weeks. Obesity-related medical problems, medical clearance for gastric bypass surgery. That is what they want in that letter. In my doctor's office, they're so great. They included a sample letter, which is awesome. So getting that done. I'm slowly but surely checking these things off, getting them done, and sharing them with you guys. Okay, other requirements. TRICARE participants will need a chest x-ray and an EKG. So I guess that helps out TRICARE. Any other requirements specified by your insurance carrier and Dr. Harris or other healthcare professional. Attend a psychological consult at the Chrysalis Center. I have that information as well. That's in Wilmington, so I have to go back up there for a few things. I don't mind. Attend 2 nutrition classes with our registered dietitian. Attend at least 1 bariatric support group meeting. So I am doing my psychological here where I live, and I'm also doing 3 months one time for over that course of 3 months, one time each month, seeing a dietitian, nutritionist, whatever. And that's pretty much what I have left after all the little things. So I'll probably, I'm hoping and assuming, y'all pray for me, that I get my surgery in December, January, something like that, around that time. So, okay. That was that. 12 steps to weight loss surgery at Coastal Surgery Specialists. Step 1, call the office and speak with the bariatric coordinator. Everybody that wants the surgery has to do that consult over the phone. They want to make sure, they want to weed you out. Just kind of make sure you're serious, that you qualify for this basically before you come on in and waste your time. Step 2, determine if your insurance plan will help pay for weight loss surgery. That's a big thing, guys. Making sure, like I said, call that number on the back of your card. Whatever kind of insurance you have, call that number. Step 3, fill out the weight loss surgery questionnaire and return it to the office. That's pretty self-explanatory. Begin organizing your medical records prior to your first visit. What I did, I was prepared to go to every doctor I've been to get the information that I needed. I'm like, you know what? I'm going to every doctor I've been to, and I'm doing all of this because I've been overweight for a very long time. At least 100 pounds. But they don't want you to do that, guys. So just make sure 3 years. Okay, step 5. First office consultation. So the first office consultation for me was kind of the group meeting that I share with you guys in meeting my surgeon. And they'll tell you everything that you need to know that first visit. You're gonna get the ball rolling. Step 6, meet with the psychologist. Everything I just shared with you guys. Don't forget to look it up. Attend nutritional classes with our registered dietitian. They may be really flexible, on that. Especially if you live far away, they may be willing to work that out. Step 8, attend a bariatric support group meeting. Knock that out, check. Call to schedule a second office visit once all of that other stuff is done. Insurance pre-approval for surgery. I want to read this, guys. Our bariatric clinic coordinator will work with you and your insurance carrier to obtain pre-approval for your surgery. You will not be scheduled for surgery until all required documentation has been received and we have received insurance pre-approval for your surgery in writing. This process can be very labor intensive, especially with Medicaid. My surgeon couldn't commute that enough with me. It's like, Medicaid, I know, doc, but I can't pay for it myself, especially being a single parent of 4 boys. Like I said, I couldn't do it without my insurance. This process can be very labor intensive and may take from 2 to 8 weeks. Oh gosh, the wait is real, right? If you are not approved for surgery by your insurance company, then someone from our office will contact you and discuss what actions need to be taken to appeal your claim. Thank God for appeals, right? I don't know how I act when that day comes, but I know I want to speak it. I don't know if you guys believe in it, but speaking good things out. I'm a very positive person. If something gets me down, you really won't know about it, depending on how I feel, to be honest. I don't hold back anything, but I'm very patient, I'm very sweet, I'm very kind, and I believe that good things come to those kind of people. Also, I'm very patient with my children. I love my babies, and I just believe that this is something that I can do for myself. So we'll see. 11. Step 11. Schedule a surgery date. When we receive insurance pre-approval from your insurance company, you will be contacted by our surgery scheduler and schedule a surgery date. At that time, you will be given an additional pre-operative information, which is including your pre-op diet, everything that you need to know, and also depending on your condition and everything. So guys, pray about it for you guys who are waiting, and for you guys who have diabetes like me, and your A1C or whatever that kind of stuff is. I haven't had mine yet, so I don't know. I know one girl said hers was really high and she had to wait. So I don't know about that, but in another video. Step 12, start your preoperative sorry, diet 2 weeks prior to surgery. Okay, pretty self-explanatory. All right, y'all. This video was very long. I'm sorry, guys. I know you guys waited long enough for it. I'm about to go wash up, get into bed, still look over this stuff. My kids were sleeping. It was good to get up here and talk to you guys again. Hopefully I'll be back Wednesday. I'm gonna try to get some footage at the office when I go meet and do my psychological exam. I'll try to get as much as I can. If not, I'll take notes and definitely share with you guys. Oh, 22 minutes, sorry. Okay, guys, have a good night, and thank you so much for watching. Bye-bye.